Hey there! How's everybody doing with this coronavirus or COVID-19 pandemic that's going on around the world? It's March 22nd, 2020, and I'm here at my back porch just enjoying the birds, the nice breeze, and the good weather that we've been lucky to have recently, and of course my little vino. Anyhow, so let's talk about this coronavirus. And this video I want to talk about how we can protect ourselves and take care of ourselves during this crisis. When I originally heard about this coronavirus is around, I'll say, end of January, when I went home to the Philippines and visited my family, take care of some business. At that point, in the Philippines, they're all wearing masks. They're all cautious about, gathering around people and stuff like that already. But for me, it was just, and I told my sister, you know what, it's just like flu. Don't worry about it. It's like media frenzy. I just didn't think it will come to this extent, this epidemic. Pandemic. So healthcare professional, as y'all know, I'm a nurse and I do work, and last week was week 1 since the president had announced the suspension of travel from Europe to the US, and also at the same time New Orleans had the stay home mandate. And with that said, it sank in really close to home for me, and it kind of reminded me of Katrina, post Katrina, when all of this is going down the pipe. So I thought about, well, what can I do? I worked last week and it was the longest week I felt like that I've worked. It seems like after Monday, Tuesday, I felt like I already worked 5 days. But anyway, I survived it, so here I go, and tomorrow I'm gonna be back to work and see what it takes me. It's a day to day, and you don't know what the day will bring and what change is gonna be made. It's because I still believe we don't know much about this virus. Yesterday actually I read something that it is also fecal and orally transmitted, so not just droplet. So we are learning as we go along, as we take care of this pandemic. Providers, what can we do for ourselves and for our family? So after work, I'll come home, take all my clothes off, and go straight to the shower before I go mind my business at home. Basically cleaning everything off of you, and just make sure you do not bring in anything that will cause harm or will cause your family to be ill. Next one is wash your hands. Wash your hands frequently. I cannot stress this enough. With or without COVID-19, we have to wash our hands every time, prior and after each patient contact. You just don't know what you're gonna transmit from one person to the next. Make sure your children wash their hands, coming in and out of the house, especially before they eat. It's kind of difficult to tell the kids not to touch their face, touch their nose. So just make sure they wash their hands frequently. When you have no access to soap and water, use the hand sanitizer. Basically introducing that virus into your body. The virus apparently get inoculated into your mucous membrane and then loves to just go down to your lungs and cause pneumonia. Next is wear a mask when you're sick. This is to protect the person that you're going to be dealing with, so you can contain the virus to yourself. It is very important that you do this because this will prevent from transmitting this virus from one person to the other. As we all know, this virus is very infectious. And of course, avoid touching outside of your mask, because the outside of your mask is considered dirty. Also, maintain a 3 feet to 6 feet distance. You know, some media says 3 feet, some says 6 feet. So do whatever you can to distance yourself. There's a new term that has been coined, which is social distancing. As we know, this virus is transmitted through droplet. When you cough or sneeze, this droplet can travel for about 3 to 6 feet. So we try to maintain that distance, so in case you encounter a person like that, then you will not be subjected to this virus. Also, practice respiratory hygiene, which I have stressed. When you do cough, try to cough against your elbow, not to cough on your hand if you can possibly do, because then your hand will then be dirty, and then you touch any surfaces that anybody else will be touching, so then causes that ripple effect. Next is drink lots of water, just basically hydrating yourself so you can flush out all the toxin that your body produces, right? I mean, that's just common sense. Next is just take some vitamin C. Vitamin C is a water-soluble vitamin that boosts our immune system and fight against infection. It strengthens one's body defense against infection, and again, as I said, it boosts your immune system. The next one, I do this every morning. Drink warm lemon water in an empty stomach. What this warm lemon water does is it stimulates your digestive system. It does boost your immunity to diseases and infection. It increases your body temperature, so it will increase blood circulation in your body, so it will also help get rid of toxin in your body. So how do you make this lemon water? Variation. Some online article says 24 ounces of water. I just use basically 3 to 4 ounces of warm water, and I squeeze half of a lemon, and because it is very tart, I also put like a half a teaspoon of honey, of unfiltered honey, raw honey. And also sometimes I put a little ginger if I like to, during the weekend I have time, or you can put a little cinnamon if you like, just to make it taste better. So it just, it's basically warm lemonade is what you're drinking, and try it. I mean, I think you would love it. Next is also take some zinc supplement. Zinc is very important to our diet. Zinc is important for the proper growth and maintenance of our body, especially protein. It also is needed for immune function of our body, wound healing, blood clotting, and all of that good stuff. I always call it zinc up, and I take about 50 milligrams of zinc a day, especially when I getting ready to travel. I will take like 50 milligrams a day for 1 week, and then during the course of the travel I may take one every other day, and then just a few days before I come back from the trip I would take zinc every day, and then that would at least help minimize these airborne diseases that we get when we travel. Next is eat a balanced diet. Eat healthy. Make sure your diet composed of a lot of fruits and vegetables, okay? So that just to give us all the vitamins and minerals and nutrition that we need to be healthy. Daily exercise is also part of this, staying healthy, meaning you need to exercise. If you can't do it every day, at least you need to at least do it 3 times a week, at least 1 hour a day. And that's part of being healthy, being active. And of course, the next one is stay home. If you feel like you're ill or starting to have some kind of respiratory symptom, please stay home so you do not spread this virus. Recently, New Orleans mayor had announced that New Orleans is going to have this stay home mandate, and which is great. So now when you drive down New Orleans, all the bars, especially Bourbon Street, all the bars are closed. They're all boarded up. So it's not business as usual. The only places that are open are, the essential businesses, which is grocery, your bank, things like that. And actually, the governor of Louisiana had announced yesterday that starting today, which is Monday at 5 p.m., all the non-essential businesses are going to be closed. So that would be good, because then that would make people stay home. Now he tells you to stay home, meaning stay home. I mean, I guess you can go out and take a walk and stuff like that, but cannot be a large group. Doesn't mean you have to go out and, you know, gallivanting and stuff like that. So staying home just so we can plateau this, as they say, plateau this virus, you know, so just plateau it out so it doesn't peak anymore, and maybe eventually it will die down and will be good. So the pandemic would end. Somehow, you know, it's just a lot of human interaction that causes this virus to be transmitted from one person to the next. So I believe staying home would be one good solution to solve this crisis. You know, the more sick people, the more it stresses the healthcare system. I don't believe we are prepared for this many people sick at one time. This many people that needing a ventilator at one time. There's nobody prepared for this. We're not even prepared for how much PPE we need to use to take care of these people. So please stay home. So if you're sick, mild symptom, stay home. Quarantine yourself, you know, just so you do not infect other people. And then just monitor yourself, monitor your temperature. If you start really having fever, see if it goes away in 24 hours. If not, then call. You know, if not, call if you're not sure. If you're really short of breath, then call. If all of us should just consider ourselves infected, or if not, carrier. We should just exercise universal precautions, just like, you know, like we do with AIDS, you know, with HIV. And if you have older parents, just check on them. Call them on the phone. FaceTime them if they have FaceTime, just to check on them, see how they're doing, instead of going to their home, because you don't know if you're infected and you might carry this to them. As they say, the older population and also the one who has pre-existing condition or have some comorbidity are more prone to getting this virus than unhealthy individual. So for healthcare provider, I found this group, NOLA versus COVID-19, I believe. And if you have some nurses, friends, you know, put them in the group, because this is a good way for us to vent and to help us morally, mentally, to get past this crisis. And just listening to some people and reading what they feel kind of helped me. So just share that group to some of your nurses' friends, and that sure would help them get through this crisis. For all the healthcare workers, nurses, doctor, respiratory tech, anybody that works with these guys, even I would even say the courier in the hospital that transport this patient, not just medical people, not just a true healthcare provider, the radiology tech, all of these people, I am so glad that you're all there, putting your lives ahead of other people just to take care of the sick, the one that's infected with this COVID-19 virus. And keep up the good work. We can fight this crisis together. Basically, my views of how to protect yourselves from the corona or the COVID-19 virus. I hope I have imparted some information to you guys about how to protect yourself from this coronavirus outbreak. And also, if you find this video interesting, please subscribe to East West Picayune and follow me on Instagram and Facebook. And if you have any other tips regarding how to keep yourself healthy and prevent getting infected by coronavirus or COVID-19 virus, please share it down below. Please share this video to a friend, one friend at a time. And stay safe, stay healthy. Social distancing is a must. Until the next time, bye!